Good morning, ladies and gentlemen. I have a interesting topic to discuss with you today, and we are going to talk about pimecrolimus, which is a topical calcineurin inhibitor in the treatment of facial vitiligo. And we've all been treating vitiligo with various modalities of treatment. So if you look at this diagram that we have for you here, pimecrolimus blocks the T cell function. It attenuates the secretion of inflammatory cytokines and therefore produces immune suppression, enhanced pigmentation. It also promotes the melanocyte migration and proliferation within the epidermis. Ultimately, we are also talking about melanogenesis, in which the melanosome formation is enhanced. So three major issues of pimecrolimus are immune suppression, melanocyte migration and proliferation, and melanogenesis. Now, the melanocytes come into the epidermis in patients of vitiligo. And in patients of vitiligo, we know that there are several cytokines and T cells which attack the epidermis in the immune hypothesis, and this is suppressed by pimecrolimus. So it's a novel topical immunomodulatory drug. It's effective even in children and young adults. You can even use it in children about 6 months of age. That is why it is a very useful medication to think about. Now, the proactive treatment with pimecrolimus promotes the decrease in the lesion size. There's a marked response which is seen especially in the face and neck. This is primarily because the skin in the face and neck is thin and the response is seen much faster there. And there is also an increased degree of pigmentation within the first 3 months of treatment. So we need 3 months to convince a patient that he is doing well so that patients don't drop out. Using pimecrolimus is useful in another method in the sense that it prevents relapse or new flare-ups of the disease. It is not associated with major side effects. We have not seen, I have not seen in the last 20 years of my career any side effects with pimecrolimus, which we see even with tacrolimus, like the burning, irritation, and inflammation. We don't see all this with pimecrolimus. And there is a convenience of application once or twice a day in most cases is enough for patients. If you look at this case, this is a young patient diagnosed with chronic vitiligo for the last 11 years. The depigmentation started in the left perioral area, progressed to the right side of the face and forehead, and confluent depigmented patches are seen on the entire forehead. I have marked this out here. There was aggravated facial vitiligo reported during pregnancy in many patients. Now, Wood's lamp examination reveals only 10% of the patches in her other body parts. There was very minimal response when treated with topical corticosteroids, and there was no response when treated with topical meladinin combined with phototherapy, and no significant medical conditions are there in this patient, and was not on any other medication at the time of presentation. The treatment regimen was rather strict. Topical pimecrolimus 1% in a cream base was prescribed twice a day. At 3 months follow-up, there was effective repigmentation on 50% of the patient's facial vitiligo patches. At 5 months, she had shown completely good repigmentation on the face with no redness or itching or atrophy like what we see in steroid therapy during the follow-up visits. So these are the pictures you see before treatment, which we showed you earlier. And you can see after treatment about 50% repigmentation. And at 5 months of treatment, you can see that the face is almost completely pigmented, except for a few spots which you see, which will also get covered fast. Now, this was way back in 2003. We had borrowed this from this particular article, and you can see the improvement, and subsequently all of us have replicated the same results in our patients personally. Now, if we look at the discussion area on pimecrolimus, since this is like just a case report, it is demonstrated to be a safe and highly effective treatment modality. It's a good tolerance level. It is better than steroids. It is easy, cosmetic-like facial application, which motivates regular use up to several months. The safety profile is noticed throughout the post-treatment period also. And there is enhanced facial repigmentation within 5 months. So there is a phenomenal therapeutic efficacy. So in conclusion, I would like to leave you with this simple message that 1% topical pimecrolimus cream is a very safe and effective therapeutic option even as monotherapy for rapid repigmentation of facial vitiligo without any side effects. So this is what we would like to share with you today. Thank you very much, ladies and gentlemen.